Mr. Kim?
Yes.
Come on back.
All right.
So, Mr. Kim, I'm a psychiatry resident. I work here at the clinic. I have to let you know that I do have a supervisor. So how this is going to work is I'm going to do an interview with you, and afterwards I'm going to go talk with my attending, and we'll try to help you the best way that we can.
Sounds great.
Okay. So what brings you in to see me today?
I guess the main reason that I'm here today is because I feel that I haven't been feeling like myself lately. What I mean by that is, like, I work as a receptionist at a law firm, and I just feel like I'm just not doing my job like I should. It's important that I get messages to people, and I answer the phone, and there's deadlines, and no one's really called me on it yet, but I just kind of noticed for myself that I feel like my skills have been diminished.
How so? What about your skills do you feel like?
I'm having a hard time concentrating. I'm having a hard time remembering, relatively simple things. Sometimes it's really hard for me to get out of the bed in the morning, and just anything that goes wrong at the office is just like, it's like completely overwhelming to me. Like the other day, the copy machine broke down, and normally, I call people or I fix it myself. I take care of things, but the other day I just kind of walked away and did nothing at all, which is concerning to me because it's just not like me to behave in that manner.
How long has that been going on?
I think I've noticed it, it's been very obvious over the past couple of weeks, but I think that this has been going on for quite some time, maybe 6 months or longer.
Okay. And have you noticed that you're feeling sadder than usual? Have you been feeling depressed?
People usually don't, ask me that question, but I guess if I really needed to verbalize an answer, it would be yes. I always have felt that I was a fairly happy and outgoing person, but lately I've been feeling anything but that.
What about feeling hopeless?
I don't think so. Sometimes I feel like my life is kind of passing me by, or I'm never going to achieve the things in life that I really wanted to, and so in some ways I guess I feel sometimes like giving up. But I think if I were truly hopeless, I don't think I'd be here today.
Okay. So there's still some kind of idea that there's better things.
I would like to think so.
Okay.
Absolutely.
Okay. And if I can ask you kind of a personal question, have you ever had thoughts of taking your life?
Boy, these are tough questions. I don't know if I expected this today. I think for the last couple of weeks, I sometimes feel like, well, what's the point in going on? Maybe it would be better if I just, if things could just end. I don't think I would ever act on those thoughts. I never have. But I can't say I've really had such kind of intense feelings as I've had for the last couple of weeks here.
That sounds really terrible.
Like I said, it's just not like me. And that's my big concern.
Okay. And have you ever had to see a psychiatrist in the past for these kinds of things?
No, I think that I've certainly had my ups and downs throughout my life, but it's never, the downs have just never lasted this long for me. I've never had these thoughts of wanting to end it all. I've never had these feeling that life is passing me by and that I should just kind of give up. So no, I've had down times in the past, but nothing to this extent.
Okay. And so never had to take medications for depression, anything like that?
Never.
No. Okay. And obviously never been hospitalized for depression.
Never.
Okay. What about substances? Are you a drinker?
I guess I've been a drinker since college, and I think it's been part of my life. my entire life. But, I have noticed I've been drinking more lately. I'm kind of ashamed to admit that, but it's true. Over the past month, I kind of have this pattern of going home and drinking 3 or bottle of wine, and I never did stuff like that before. It helps me sleep. I haven't been sleeping well, and I kind of pass out and get up the next day, and no, I don't feel great, but I do what I do to get me through the night.
Has it affected your work at all with drinking?
I certainly don't feel as chipper in the morning, and I don't, like I said, no one's really said anything to me. I haven't had any glaring omissions, but in the back of my mind, I fear that things could catch up.
Sure. What about other substances, like marijuana or?
Happy to say no. I mean, I've had my experimentation stages in the past, but it's probably been 20 years since I've dabbled in anything else.
And what about in your family? Any mental illness in your family?
In hindsight, not that they were ever formally diagnosed, but I think my mom may have suffered from depression. She certainly, to me, didn't seem like a happy person, especially during maybe the latter third of her life. Just seemed to be kind of pessimistic and just not looking forward to things like she once had.
But never diagnosed, right?
Never diagnosed.
And no substance problems in the family, anything like that?
No, not to my knowledge.
Is there anything else that we haven't talked about that's particularly bothersome to you that you feel like I should have asked about?
No, I think you did a pretty good job, and if I could just reiterate that I'm just not myself these days.
Well, I'm going to step out and talk to my attending, and I'll come back and talk with you about the options that we have available.
Very good. Thank you.
So, tell me about your patient.
So I just saw Mr. Kim. He's a 53-year-old gentleman with no past psychiatric history. But for the past 6 months, he's felt like he's really just not himself, has been feeling depressed, feeling kind of anxious about how things are going at work, losing concentration, not feeling like he's getting his work done the way that he wants to. He says he's having trouble getting up in the morning, and he's been having trouble sleeping. And sometimes he does have some passive thoughts of suicide at times within the past couple weeks. He's also increased his drinking recently to a couple bottles of wine every other night or so. Sounds a little problematic, but he recognizes that it is problematic, and that he drinks so that he can sleep better. So I do. He doesn't have a family history of mental illness, other than he thinks that in her older age his mother may have had some depressive symptoms, but not diagnosed. Never attempted suicide, never been hospitalized for depression, and other substances, he denies other substances.